Welcome back to QD Clinic. Hi, I'm Jack Cush with RheumNow. QD Clinic is brought to you again by RheumNow.Live 2023. Meetings that matter, meetings that change thinking, meetings that are meaningful. Be there. Today's case, a 35-year-old male comes to you saying he just got out of the hospital 3 weeks ago. What's his story? He said before that, 6 weeks before that, he was developing shortness of breath. It was getting progressively worse, and it was accompanied with chest pain. The chest pain was worse with deep breaths, was worse with coughing. 2 weeks prior to admission to the hospital, he had a fever of 102. He went to his family doc. They did a chest x-ray. It was negative. He was given a Medrol dose pack, really didn't get any better, and several days later, he was hospitalized. On admission to the hospital, they diagnosed pericarditis. It was evident. He had a sinusitis-like pain, worse with cough, worse with position. He had evidence of an enlarged heart. He had echo evidence of an effusion. He did not have EKG changes. So while he was admitted, his fever went to 104. He had body aches. He actually had several episodes of hypotension, was sent to the ICU. There, he underwent pericardiocentesis. They removed a half liter of exudative fluid. Serologies on the fluid were negative. The man's labs were, other than a mild ANA of 1 to 80, the only thing that was abnormal was his acute phase reactants. His white count was not really elevated. He wasn't anemic, but his CRP was 32 milligrams per liter and sed rate was 99. He's got a family history of lupus in his mother, so who knows what his ANA means. Again, in the hospital, they did the drainage. They tried treating him with colchicine, nonsteroidals, and steroids. Initially high, discharged on 30 or 40 milligrams, still with chest pain intermittently, still with an effusion on the last echo. He says the pain comes with laying down or bending over. He has a history of mitral valve surgery about 5 years ago, eczema, back pain, and he said he had pleuritis treated 1 year ago with a few weeks of steroids. The question is, what is this? Could this recurrent pericarditis, is this recurrent pericarditis with fever? Could this be due to lupus? Other than the ANA of 1 to 80, there's no other evidence of lupus. What would your workup be? You might order a bunch of serologies. They would prove to be negative. You might do a PPD on him. You might, or get a quantiferon on him. You would send his fluid and his blood cultures for culture for AFB and also for fungal cultures. All that came back negative. So the diagnosis here is idiopathic recurrent pericarditis, the autoinflammatory syndrome that is almost defined as a condition that is unresponsive to nonsteroidals, colchicine, and steroids. Turns out that pericarditis is a common complication of acute pericarditis. So it's estimated that patients who have acute idiopathic pericarditis, up to 30% of them may have future recurrent pericarditis, and maybe those are the ones who have this autoinflammatory syndrome. This idiopathic autoinflammatory recurrent pericarditis, that's a mouthful, is thought to be IL-1 mediated. Involves the inflammasome. The white count's usually high. They may have a lymphopenia, but they usually have very high acute phase reactants, and they are usually seronegative. The differential diagnosis of pericarditis presenting like this is pretty wide. A lot of autoimmune conditions, including lupus, MCTD, myositis patients, GPA, EGPA, RA, IgG4-related disease, FMF, TRAPS, CAPS, Stills, systemic JA, sarcoid, Kawasaki's, GCA, and Takayasu's, and of course the big one, infection. Could this be a paraneoplastic presentation? Probably not, right, with this kind of presentation. The new thing this year is that an IL-1 inhibitor has become FDA approved for patients like this. The literature is replete with many reports of patients failing those other therapies that you would normally use and responding really well to either anakinra, canakinumab, or rilonacept. This year, based on the Rhapsody trial, it was a trial of rilonacept, a randomized withdrawal style trial in 86 patients with recurrent pericarditis showing clearly a significant benefit. So these patients rheumatologists may be called in to see. I think the cardiologists usually make the diagnosis and may be asking the rheumatologist for help. Think about it. Recurrent pericarditis brought to you by RheumNow.Live, March 18 and 19. You can register at RheumNow.Live. We'll see you there.